am Dr. T.S. Kler. I am Chairman of Fortis Heart and Vascular Institute in Gurugram. Today I would like to share some ideas about heart disease. First of all, I want to tell you that heart disease is not of only one type. There are various types of heart diseases. One is congenital heart disease, where the child is born with some heart abnormality. Now, usually the incidence of congenital heart disease is something like 3 per 1,000. That means if 1,000 babies are born, around 3 babies will have some kind of congenital heart disease. And out of this congenital heart disease, usually there are some holes in the hearts, or the valves are narrow, or there may be some combination. There are diseases where the baby is blue. That's called cyanotic heart disease. Sometimes the babies are born with a very slow heart rate, so-called complete heart block, and they may need a pacemaker even on the first day of their birth. But if the baby is born with a normal heart and the heart disease occurs later on, then obviously it is called as acquired heart disease. Now, I would like to tell you what kind of acquired heart disease is wide prevalent in our country. Number one is the rheumatic heart disease. Now, rheumatic heart disease occurs because of a complication of a rheumatic fever. Now, this usually is because of a complication of a specific type of sore throat caused by streptococcus, and usually children between 5 and 15 years of age, they get rheumatic fever. In rheumatic fever, there is a fever and there is a pain in the joints and the swelling of joints. But all these things, they disappear with medication, but there is a problem is that the heart is permanently damaged. In heart, either the valves start leaking, or they become narrow, or there may be a combination. So this is a very common heart disease in India even now, though rheumatic heart disease has almost disappeared in the Western civilization. It is directly related to the socio-economic status of people. People who are well off, there is less crowding, their per capita income is better, the rheumatic heart disease is very less or almost disappeared. But people who are relatively poor, they live under crowded situations like Bihar, UP and Odisha, there is still a lot of rheumatic heart disease. So another type of heart disease is which is called coronary artery disease. Now, coronary artery disease is the disease which a common man in India thinks that's the heart disease. Now, what is coronary artery disease? The heart is a muscle. Our heart is a muscle, and this muscle sends blood to the whole of body. Though there is a blood inside the heart muscle itself needs blood, which comes through two coronary arteries. They are the first branches of aorta, the tube which carries blood from heart to various parts of the body. So there is right coronary and the left coronary artery. The right coronary artery supplies around 20 to 30% of the heart muscle. The left supplies around 70% of the heart muscle. Left is a bigger system, and it divides into two branches. One comes in front of the heart, which is called as LAD. The second division goes behind the heart in the posterior aspect, which is called as circumflex. So though there are two initial coronary arteries, but in general we consider three because the left system is bigger and it is divided into two main branches. Now, coronary artery disease is a disease where there are deposits inside the coronary arteries, and it blocks them to a various level. And people with the coronary artery disease, either they get angina, so-called chest pain when they do some kind of exertion, or they can get heart attack. It's called acute myocardial infarction, or many patients become with breathlessness, so-called heart failure. Some percentage of coronary artery disease will have sudden cardiac death. There may not be previous symptoms, they die just suddenly. So these are the few manifestations of coronary artery disease. And coronary artery disease is the biggest problem in our country. Roughly 8 to 9% of adult population in cities, and around 5 to 6% population in rural India, they have coronary artery disease. This is a big challenge. This is like an epidemic in India, and it needs a lot of healthcare infrastructure to deal with this problem. So now let's go to another kind of heart disease which is called as cardiomyopathy. Now cardiomyopathy is a disease of heart muscle itself. That means the coronary arteries are okay, the valves are okay, but the muscle itself gets disease, and this may be usually a consequence of some kind of a viral infection or some toxins which can make the heart weak. There are certain diseases like sarcoidosis or amyloidosis or tuberculosis which can also involve the heart muscle. So in this situation also the heart can become enlarged and people start getting breathing problems, and this is called as cardiomyopathy. Now the last main category of heart disease is arrhythmias of the heart. Now normally our heart is made in a way that usual heart rate is between 60 to 100, particularly when the person is not doing much activity. So anything below 60 is called bradycardia, anything more than 100 is called tachycardia. Now this bradycardia and tachycardia could be physiological. For example, when a person is not working, he is sleeping, the heart rate can go below 60, even up to 40s. That's not abnormal. On the other side, if somebody is exerting or there is anxiety or there is a fever, the heart rate will go up more than 100. So there is a tachycardia, but this is not a disease, it is a physiological tachycardia. Now there are disorders of the heart rhythm where the heart rate can be slow or it can be fast without any reason. So then it's called abnormal. That's a pathological bradycardia or pathological tachycardia. So you could have 2, 3 or 4 types of rhythm problem. That means you can have a bradycardia, abnormally low heart rate, or you can have a tachycardia, abnormally high heart rate. You could have irregular heart rate, or you could have any combination. For example, the heart rate may be slow and irregular, it may be fast and irregular, and sometimes there are situations where the same patient may have both the combinations. So primarily the anything which has to deal with the rhythm of the heart is called arrhythmia, and this is roughly if you consider all the heart patients, roughly 20% of heart patients they have some kind of rhythm problems. And the good thing is to understand that the rhythmology or the electrophysiology has advanced nowadays to an extent that most of these arrhythmias are either totally curable or they are controllable to a lot of extents. Thank you very much. This is in brief the type of heart disease which we have in our country. Thank you.